Hello, everyone. Good evening here in the Philippines, and good morning here. It's 2 a.m. here in the U.S. 4 a.m. in in the East Coast, and 2 a.m. here in the Pacific Coast in California. We are live in TTMU podcast, and so um, welcome to PTMeal. It's a podcast about some insights and inspiration or information regarding physical therapy profession and practice. So, um, e- welcome everyone. I'm Johan De La Paz. I'm the host of PT Meal Podcast. So, um, for everyone new here, so the podcast can be heard and listened to in different podcast apps, in Spotify, in Apple Podcasts, Google Podcasts, iHeartRadio, Amazon Music, and many more kung saan kayo nakikinig ng mga podcast ninyo. For sure, or malamang sa malamang nandun ang PT Minute Podcast. If you want to listen to Filipino physical therapists in their settings and in their specialties. Okay, thank you everyone who's watching. And if you're not following us yet in our social media accounts, uh, we are in Facebook, Instagram, Twitter, and LinkedIn to be updated in our I know uh, new episodes for the podcast. So, yeah. So for this live, this is one of those solo podcasts na I do every now and then. I do it live, record it, and publish it in audio format. As another form of sharing information. And speaking of sharing information, gusto ko lang i-share this time yung ina-attendan kong course, which is our topic for today. It's a course on primary care physical therapy. So, if anyone there um, watching who's interested, in the topic, if you have any questions or feedback or comments to what I'm saying, yeah, join in. Comment your feedback, and I can read them. Or if you have any questions, I can also answer them live here. So, ayun. So, primary care physical therapy. Um, kasi when you say primary care, we know that sila yung mga first contact to the patient, no? Sila yung um, how would what do you call this? How would other So sila yung unang nakikita ng patient, sila yung unang kinakausap ng patient. In short, they are the first healthcare professionals that patients seek for their illnesses or their conditions. In the U.S., so there are different primary care practitioners. There are syempre nandun yung doctors, nandun din yung mga nurse practitioners. They are your non-physician practitioners. So, nurse practitioners and your physician's assistants. So, sila yung tumatayong primary care practitioners. Oh, meron pa pala yung isa, doctor of osteopathy. So, sila yung mga um, kinikilalang ng Medicare as primary care practitioners. So, primary care physical therapy, saan papasok yan? Since there was already a lobby, and most of the states in the US have allowed direct access sa um, sa PTs. So patients or people can directly uh, consult a physical therapist here in the US. So um, physical therapists can you know uh, see the patient first and assess the patient, see the patient if the patient needs uh, other consult, or physical therapist can already address what the patient is complaining. Tingnan natin yung salita. Alright? So what do you call this? So I kind of prepared something here just to share some information, some research about being a primary care practitioner in physical therapy, kung why we want to advocate that. Kasi di ba in the Philippines, people or patients need to be referred by a physician first, a primary care practitioner, and that uh, pose some struggles and barriers, problems for our patients. One of those is cost, and second is access. So anyway, let's probably start with what I prepared here. So the APTA, the American Physical Therapy Association, has released a position on primary care physical therapy. They say that physical therapists make unique contributions as individuals or members of the primary care teams and are entry point providers in the healthcare system. Physical therapists provide a broad range of services to optimize movement, including screening, examination, evaluation, diagnosis, prognosis, intervention, coordination of care, prevention, wellness, and fitness, and when indicated, referral to other providers. With with this definition ng American Physical Therapy Association, to my colleagues in the Philippines, di ba, it's something that we also do and believe that we do in in there as physical therapists, right? So we screen, we examine, we evaluate, we have our physical therapy diagnosis, we provide some prognosis on the conditions, we provide intervention, and we coordinate care with the patient. We are part of the prevention spectrum, primary prevention, secondary, tertiary, and we can also provide wellness and fitness interventions. And we can also say that the patient may need some referral to other specialties. So yung yung position ng APTA can also be reflect what as Filipino physical therapists in the Philippines have been talking about since since matagal na. Um, so this study by Charles was became popular in social media when it was released. Sorry, medyo giniginawa ko kasi malamig dito sa kwarto. So yung ano na yung study ni Childs, it was in 2005. They examined the knowledge of um, physicians as well as physical therapists in managing musculoskeletal conditions. So aside, excluding the physicians who are trained in orthopedics, let me try to maximize that for everyone. Yun. So aside from this, physicians who are practicing in orthopedics, physical therapists demonstrated more knowledge than other physicians in the study. No? So ang nangunguna dito are physical therapists who are trained in orthopedic specialty and sports specialty. Yun yung OCS and SES. It's orthopedic clinical specialist, sports clinical specialist. The next are physical therapists with no OCS or SES. The next are physical therapy students that are in their doctorate programs, clinical doctorate programs, and physical therapists who are in their master programs. So the rest are physicians. So the result of the study shows that physical therapists have demonstrated more knowledge in managing musculoskeletal conditions kasi mas familiar sila in their training, mas focus tayo in, you know, in trying to assess and screen and diagnose musculoskeletal conditions and treat them as well. Wala naman ito siya. All right. Um, so so we are in that position kasi di ba usual complaints of patients are pain, right? So we are in that position of base knowledge and as the study showed, some expertise, like if you're in focusing on orthopedics and sports, we are in that position to be able to address to the needs of the patients right away when they need them. And we are also in that position to say that, okay, this patient needs more examination and and not just physical therapy. Uh, so yun. So another study, which was also became popular when it was released, was the study of the lean method or path to recovery by the Virginia Mason um, Medical Center. So the old approach of patient going to physicians for their low back pain treatment, as you can see here, no, um, patients would people would go to their doctors first, initial meeting with the doctors. Then the doctor would refer the patient to a specialist. Then the specialist would have the patient undergo imaging, MRI, and the patient would follow up with the doctor. Then the doctor eventually would uh, refer the patient to the physical therapist. And the new approach of Virginia Mason Medical Center was to let the patient go to a physical therapist, access the physical therapist first for their back pain. No, if there is any complication in the symptoms or the condition, then that's when the physical therapist or would be the patient would be referred to a specialist. Unless or otherwise, the physical therapist can address the patient's condition, thus saving the hospital and the patient the cost of all those unnecessary diagnostic exams. So they found out like it created 50% reduction in overall cost when the physical therapist and PCPs or primary care physicians collaborated in the triage of the patient. So there is a 33% reduction in MRI use. And the patients were able to go back to work in 4.3 days versus the average of 9 days. So, ang laking benefit nun for the patient. Lesser cost, earlier return to work, and lesser use of unnecessary imaging and radiation. There was also a study before that, or a research before that, that shows that if you place people on a certain age, I think 35 or 45 years old and older, you will see degenerative changes in their spine. And no, not everyone though of those who demonstrate degenerative changes of the spine would present with any pain. So that tells us that whatever we see in the imaging doesn't really equate to complaints of pain. So um, sometimes the imaging can be detrimental for the patient's psyche, not knowing that they would be told by their doctors that, oh, I was told that I have a degenerative disc disease or I have this narrowing, and they create that psyche or their mindset that I'm getting old, I'm getting weak, I have this condition. So it somewhat uh, creates a bad image or fear already to the patient, that they would think that they already have something serious. Um, yeah. So the next one is another study where they collected um, studies on different primary care practices. This is good because it's a position paper. It's a call to action for direct access to physical therapy. Historically, in the U.S., um, the the military has used physical therapists as one of those entry point or direct access practitioners where soldiers can directly consult physical therapists regarding their complaints, and they found that it decreased, it promoted early return to duty and decreased uh, the soldiers from going back to where they're to the US from where they were stationed. So um, so there's a lot of studies already showing the benefits of giving people or patients access to physical therapists. The child's study was I mentioned earlier, where PTs outperform physicians, with the exception of orthopedic surgeons, in musculoskeletal conditions. Another one is that PT care versus family care practice group patients were prescribed less medication and were referred to fewer imaging, which was also evident in uh, the pathway to recovery that I showed earlier. So there are there were in one study there were 15% referral rate from PTs for diagnostic imaging. Um, excuse me. So in civilian physical therapists, as you can see, there are 14% fewer PTs visits for direct access, 1.5 fewer visits for direct access. So this study just shows the different researches on physical therapists and the benefits of giving direct access to people to physical therapists. So we will appreciate none that giving that power or autonomy on to our patients to get that immediate attention. Kasi I think that the problem with some of the problem in the Philippines is that cost. Um, Pangalawa is access, especially in rural areas. Um, so physical therapists can alleviate that burden. So as I was saying, in the Philippines, there is no direct access verbiage or law yet. Um, I think the new bill that was being passed may offer um, a way or a pathway for physical therapists to eventually explore that direction. But so far, our RA 5860, the current law that the physical therapists are following, it's explicitly said that to practice physical therapy, a patient should um, get a referral from a doctor prior to uh, physical therapy treatment. Also, there is no education to promote, autonomous practice in the Philippines kasi nga wala pang law that would open the doors for direct access for physical therapists. And physical therapists cannot act as a first contact or primary care practitioners. Pero in some cases, physical therapists can act as the first entry point, right? In special cases like um, what do they call this? Sports. If the physical therapist is the only medical professional there, then the physical therapist would have the first contact with the patient and the injury as a first aid, right? But other than that, physical therapists are not, supposed to be the first contact healthcare worker for the patient. But uh, are we saying that is primary care physical therapy just the practice area? Is it just gonna be beneficial for those who have private practice, or is this a philosophy? So is primary care a place where physical therapists work, or is it a mindset on how to approach and treat patients? So in enrolling in the course that I'm in now, hindi pa siya tapos. I'm on my third or fourth week of attending. Uh, we kind of decided or thought about primary care physical therapy as a mindset of approach to patient care. So though in several settings here in the US, uh, we don't have direct access because we are, like, for example, you're under a hospital system. Syempre, patients are not going to be directly accessing you. You'll be seeing the patient based on the referrals of the doctors. But the philosophy of being a primary care physical therapy can span all all settings and all specialties and all practices. Kasi what you do as a physical therapist is you thoroughly assess a patient, screen the patient, make sure that there are no red flags or yellow flags that can affect the rehabilitation process or rehab plan for the patient, and for uh, and see if the symptoms are are reflecting what the patient is saying to you, no? So, medyo ang reason ko kasi kung bakit ako nag-attend or enrolled in this course, because in the hospital that I am in, uh, patients are being referred to physical therapy with diagnosis of pain without um, a medical diagnosis of what caused the pain. So, as a physical therapist, I would want to explore that pain. Saan ba nanggagaling yung pain na yun? Anong cause ng pain? Kasi our rehabilitation or treatment plan can be based on that. And no, we want to catch something that are far more sinister, and we don't want to overlook anything. Um, we appreciate, I mean, for me, I appreciate that the doctors or the physicians are giving me the independence of assessing and the trust on knowing what to do with a patient. But sometimes it can be difficult if you don't have an idea what the pain or the complaint was coming from. So that comes in, that's where your physical therapy, primary care physical therapy mindset comes in. So you screen, you assess, you evaluate, and you create a diagnosis. And from that diagnosis, you create your plan. You talk to your patients, you collaborate, you tell them this is what I think you have, and you know, we try to explore that. And also, so the next slide I have is, diba, we do that all that decision making during evaluation while the patient is there. Sometimes we wait for a while and try to research and try to hone on that ano, hone on that, stick to that diagnosis or that processing. Pero there's one framework which was really helpful for me that I was able to use was from a study here, International Framework for Red Flags for Potential Serious Spinal Pathologies. So this type of framework can work with other types of um, pathologies as well. What does the evidence tell us? Have we screened for red flags? What is the prevalence of that pathology if that red flag is um, present in the patient? I'm looking. I'm what do you call this? I'm talking about this one, the first box, the first figure. So identifying red flags, then red flags in combination with red flags. Okay, so we screen the patient for red flags, yellow flags, and what is our level of concern? Then that's when we you know probably consider as well yung clinical profile niya, any comorbidities, uh, repeat visits, urgency, and what is the urgency or the consequence of delay if we delay, and what should we do, and what is the symptom progression if tama yung diagnosis na iniisip natin. So the level of concern is here in the next box. So if there are, low or no concerning features, you don't see any red flags, then we begin trial therapy. Revise management if the clinical features change unexpectedly. But if there are no red flags and we're not expecting for changes to occur, then we continue with it, right? So dito medyo tayo nagkakatalo in the middle. If there are, concerns that we see, are we gonna be are we sending the patient to a doctor right away? Are we gonna wait? So if there are few like if there are few features that somewhat concerns us, we can begin a trial physical therapy, but with a watchful waiting, meaning we continue to observe the symptoms. We tell the patient that this is this is what we that I am thinking that you have. We'll start therapy and we'll um, see how that affects your condition. Then you would tell the patient, you safety net the patient. So, for example, you're suspecting a called the equina syndrome. You will tell the patient, oh, you have, be mindful if you observe any um, numbness in the inner part of your thigh, in your groin area, then that's something of concern. Then that's when you go to your doctor right away. So while being watchful and being doing your trial physical therapy trial plan, you also provide or inform the patient what are the signs and symptoms that they should observe. In case they feel it, they can go to their doctors right away. So if there are more concerning features, then you can decide if the patient needs to see their doctor urgently or emergent. So urgent and emergent. So urgent is when you see some concerning features, you urgently refer to the doctor. Don't start any trial therapy. Make sure that the doctor knows what you have found and that the doctor can continue the care. Pag emergent naman, like I don't know magandang example ng emergent like um, thrombus. Let's say you went to see a patient and you see that there's swelling, redness on the legs, mga ganun. Um, that's something very, concerning, that you want to make sure that before you do physical therapy and have the patient walk around, move her legs, you want to make sure that that is stable, right? So, minsan dito tayo nagkakatalo sa middle part kasi medyo doon may labo eh. Are you gonna be just watchful, or you're not gonna start physical therapy? So yeah, so being, a primary care physical therapist would not entail the practice, but would entail a mindset of being able to screen, being able to defer, being able to diagnose a patient, and be able to be a consultant, so to speak, uh, in that case. Keso dumating siya with a referral, keso hindi. If you see that there's, something off in the diagnosis, the symptoms, then that's something that we can catch as a physical therapist. So we are at the, you know, uh, helm and the position to do that. We see the patient more often than doctors, and we assess the patient continually. Every treatment that we have is not just a treatment session. It's also as an assessment session. So the assessment day, kahit di siya re-evaluation day, we still evaluate the patient. Di ba? We ask for pain. We ask for symptoms since the past week. We ask for changes, and we ask for, you know, uh, improvement or aggravation. So that's yeah, that's it. That's what I wanted to share about primary care physical therapy, and I am looking forward for what would happen to our practice in the Philippines. Hopefully, we can advocate for start to discuss the ways that patients or people can access physical therapy right away without any referral, because that would really cut time, cut cost, cut unnecessary imaging and diagnosis, and you know help promote the trust in the healthcare and medical system. No, kasi people would think that being seen by medical professionals is a burden, kaya they run to shamans, to uh, people who they think would fix them right away. So I think with that culture, Filipino culture of going through to shamans and fixers and healers, and you know going through the busy highway of medical system, kaya mas pinipili nila yung madali healers. If we can make it easy for people to access their needed care, then I think their trust would come back, and uh, we would earn their awareness and their trust, and they would know who to access for certain things. Okay, that's all. If you're gonna watch this, if you're watching this on the replay, and you feel that primary care physical therapy is something that you're um, advocating about or are interested in, just comment it in under the video, and let's share experiences, and hopefully we'll reach that time where patients or people can access physical therapy for their care. All right. Catch the next episodes of PT Meal Podcast. Marami pang nakahanda. We'll be celebrating our third year next year. 2023. We started at 2020. Actually, I started 2020. Ako lang ang nag-edit, nag-host, nag-research ito. And thank you for the support, everyone who are listening. Until next time, again, this is Johan de la Paz for PT Meal Podcast. Stay well and be kind to everyone. Thank you.